Hi, welcome back to Unified Oski. In this video, we'll be having a look at an assessment of a scenario of Alzheimer's disease using the CIT test form, that is cognitive impairment test form. So come along with us. So as I approach the scene, I can confirm the scene is safe to approach. There is nothing to cause harm to myself or my patient, and I'm actually looking. I ensure privacy is provided by pulling the curtain. I go ahead to do my hand hygiene, putting an ample of gel. I roll palm to palm over back of hand, vice versa, palm to palm, fingers interlace, fingers interlock, vice versa, rotational rubbing of the thumb, rotational rubbing of the thumb, my fingertips on palm, vice versa, my wrists in rotational manner, my wrists in rotational manner. Allow my hands to dry for 30 seconds. I will go ahead to put my apron. Now put my glove. I've confirmed with my assessor that my instrument is calibrated, clean, and ready for use. So with my instruments, I will go back to my patient side. I'm going to my patient side. Hello.
Hi, nurse.
Yeah, my name is Ademola, and you're attending us for today. I'm here to do an assessment on you using the A to E approach. Ask some few questions on activities of daily living and also go through your 6CIT form, the cognitive impaired test form that you have filled with you. Is that a good time to do that?
Yes.
Oh, wonderful. But before I go ahead, I would like to confirm your full name and address as I confirm with the documents and I have with me. Is that okay with you? Yeah, can you tell me your full name, please?
James Smith.
Oh, wonderful. I can see I've got James Smith on my document. Your date of birth?
1165.
Wonderful. 111965 I've gotten on my document. Can you tell me your home address?
Yeah, I live here at Garden Grove, Oxford Street.
Wonderful. Yeah, I can see from the history that you live in the nursing home, and that is Garden Grove Nursing Home, Oxford. Wonderful. Yeah. James, I'm sorry. What would you like to be called?
James is alright.
Oh, wonderful. James, have you got any allergy to food, drug, or latex?
I've got an allergy to tramadol.
Oh, I can see that on your documentation. Sorry about that. And what happened when you have an encounter with tramadol?
Start vomiting and get rashes.
Oh, it's noted on your documents. And I want to assure you that throughout the care with you, I'm not going to administer anything containing tramadol. And this is escalated to the whole team as well. Are you happy with that?
Yes, nurse.
Oh, wonderful. Yeah, James, I just want to check with you. Have you been resting in the last 30 minutes?
Yes, nurse.
Oh, wonderful. Can you hear me? Can you see me well?
Yes, perfectly.
Oh, are you in any form of pain or discomfort?
Yeah, at times when I use the bathroom and pass urine.
Or you feel some pain? You're still in pain at the moment?
No, nurse.
Not at the moment.
No, just when I use the bathroom.
Sometimes. Okay, but not at the moment.
Yes.
You are comfortable at the moment.
Yes.
No any form of pain.
No.
Wonderful. That's a good one. But as regards the pain with urination, I'm going to note that and I will let your doctor know about it. Is that okay?
Yes, thank you.
Okay, that's wonderful. So, like I said, I'll be doing the A to E assessment on you. Are you still happy for me to continue?
Yes, nurse.
Okay, wonderful. I'm going to be using, is it okay to use your left arm
Yes.
to do your blood pressure?
Yes.
I'm starting with that. Have you had any surgery on this arm?
No.
Okay, I can see there's no swelling, no redness, no any form of lesion, and you've got no cannula on that arm. Can you make sure your legs are uncrossed, please, James?
All right.
Okay, wonderful. I can confirm I have the right size of curve with me, so I'll be wrapping that to cover 80% of your upper arm. Not too loose, not too tight. Okay, 2 to 3 centimeter above the antecubital fossa. Wonderful. You will feel some pressure as I try to put the inflate the curve, but never mind. As soon as I deflate it, you'll be fine. Is that okay with you?
Yes.
Okay. Like that is going on. Can I make use of your other hand, your fingers, please? Okay. Thank you. And I'm looking at your fingernails. I can see it's not cold, it's not clammy. You've got no artificial nails, no nail polish. Okay, I depress your finger for 5 seconds. 1, 2, 3, 4, 5. I'm releasing that. I can see your capillary refill is less than 2 seconds. Wonderful. So I'm going to put the probe just to check your saturation. I'm doing that and it's done. Your oxygen saturation is 96%. I've noted that on my paper. And I'm done with the blood pressure. I can see that is done. Your blood pressure reading is 110/70. So I've noted that. So we're done with that. I'm going to be checking your temperature. I will be using your forehead if you don't mind. Is that okay?
Yes.
I can see your forehead, there's no rashes, there's no sweating, there's no any form of wound. You hear a bleep sound, and that is your temperature reading. Okay? And that's done. I'm done with the temperature. James, is it okay to just hold your wrist? I will need to check your heart rate. At this point, I will need you to be quiet for 2 minutes while I check your heart rate. Is that okay with you?
All right.
Okay, wonderful. So I'm holding your wrist. I'm trying to locate the radial artery, and I've located that. So I'll be counting. So I'll be counting now. I'll need you to be calm. Is that okay? Thank you. So, assessor, my time starts now. Hi, James. Yeah, thank you for your time. I'm done. Yeah, I'm sorry. I actually counted your heart rate for 1 full minute, checking for the rhythm, the rates, and the pattern. Okay, and I check your respiratory rate for 1 full minute as well, checking the rising and falling of your chest, and checking the rates and the depth of your respiration as well. I can see there's no use of accessory muscles. You're not having any problem with your breathing. I'm sorry, I didn't tell you that at the beginning. No, this is just to prevent alteration in your respiratory pattern, because when you're conscious that I'm looking at your chest, that can alter it. Is that okay with you?
Yeah, that's fine.
Okay, wonderful. So I've done with the assessment. So I've actually started from the airway. When I came in talking to you, I can see there's no any visible obstruction in your airway. You can talk to me in complete 2 to 3 sentences, which is wonderful. So your airway is clear, there's no any obstruction. I'm happy with that. Moving to the B, which is the breathing. So for your breathing, I checked your respiratory rate. Your respiratory rate is 12, which is though a little bit low, but it's still within the normal range. And I check at the rising and falling of your chest. I can see there is no any form of wheezy. There's no use of accessory muscles with your breathing pattern, and that's wonderful. And I as well check your saturation, which is your oxygenation level, and that was okay as well. That was 96%. Okay, moving to the C, which is the circulation. I check your blood pressure. Your blood pressure is fine, is 110/70. So it's like a borderline, but it's not, it's borderline low. And because of that, you're scoring one on that. But we just keep an eye. But previously, is your blood pressure always on the low side?
Yes, at times, nurse.
Okay, so that's maybe normal for you, but you're scoring one on that. But we'll let you know what the plan is as regards that. And also, your capillary refill time is less than 2 seconds, which is wonderful. It shows you are well perfused. You don't have any problem with your circulation. And your heart rate is normal. Now, moving to the D, can you wiggle your hand for me, James?
Yes.
Can you wiggle your legs?
Yes.
Wonderful. I can see, even talking to you, I can see you're well oriented and you can obey command. Assessor, can I confirm the blood sugar of James? It's normal. Okay, within normal range. That's wonderful. Okay. James, have you had a wee in the last 2, 3 hours?
No, nurse.
Okay. When last did you have a wee? Oh, so you're having problem with your wee?
Yes, nurse.
Okay, that's okay. Like I said, we're going to note that, and it will be escalated to your doctor that you're having pain when you are trying to make a wee. Okay, that will be noted, and that will be escalated to your doctor. Blood sugar is within normal range. The assessor have told me that. So now moving to E, which the exposure. Looking at your temperature, it's borderline 37.5, though like low grade form of high temperature, but we'll still keep an eye on you as regards that, though you're not scoring on based on that. And the part of the body exposed, I can not see, there's no any visible wound, rashes on your body. Assessor, on the parts covered on James, is there any visible wound or rashes? Okay, no, wonderful. So that's all I've got for you, James. Well, just give me some minutes. I will just go to plot your news chart. The news chart gives us an idea of how often we need to check on you. And I'll be back in few minutes. Is that okay?
Okay, nurse.
Wonderful. If you need anything, give me a shout and I'll be right back. Okay. Thank you for that. So I'm going to plot my news chart. The temperature is 37.5. It's a score of 0. The pulse is 86, a score of 0. The respiratory rate is 12, a score of 0. The saturation is 96, a score of 0. Blood pressure is 110/70. I have a score of 1. So James is scoring 1 based on that. So I'm going back to James. I will have to do my hand hygiene, leaving. And when I'm back again, I will need to do my hand hygiene. Hi, James. I'm back, like I said. Hi, you okay, James?
Yes, nurse.
Okay, wonderful. So, based on the new score, you have a total new score of 1. And this means that we need to check on you every 4 to 6 hourly. I'll be back to check on you again to do a reassessment on you. And I've informed the registered nurse who will also decide on assessment and also if there's need for escalation and if there's need to increase the frequency of monitoring. So, but it's nothing to worry about. So, are you happy with that, James?
Yes, nurse.
Okay, wonderful. So, James, I would need to ask you some few questions on activities of daily living. Do you have any problem with your mobility walking around? Can you walk around on your own?
Yes, nurse.
Wonderful. And as regards your elimination, you told me about pain with urination, and that is well noted. We're going to escalate that to your doctor. Do you have any problem with your sleeping, nutrition, eating? Any problem with that? Any concern?
No.
Okay, wonderful. And with your breathing, do you have any difficulty in breathing?
No, no, nurse.
Wonderful. So I've noticed all that. So thank you. I've noted all that. So I'll just, and for your psychosocial history, I can see based on the documentation that you live in the nursing home. Is that true?
Yes, nurse.
And I'm sorry, I learned your wife died some years back. Sorry about that. We if you need any help, we'll be referring you to the social support. And I know the nursing home are taking good care of you. Is that true?
Yes.
Okay, wonderful. So, do you have anything you want to share with me as regards your spiritual needs or your sexual needs? Anything you'd like to share with me?
I'm a Christian and I go to church.
Okay, that's good to hear. We just need to know. In case you need any help with your chaplain to visit you, just let us know. Is that okay?
Yes, ma'am.
Okay, wonderful. Do you want to share anything with me as regards your sexual needs?
No.
Okay, wonderful. Just need to ask. That's wonderful. So, regards the CIT form, I can see you have a score of 4 when you need to count backwards from 20 to 1. No, you miss more than 1, and you had a score of 4 in that. And as regards repeating the 5 components address that was given to you to keep in mind, you had a score of 6. That means you had 3 errors as regards repeating that as well. Is that true?
Yeah.
Yeah, so you've got a total score of 10 over 28. And this is gives us a diagnosis of that is suggestive of some level of dementia. And from your history as well, I know you have history of Alzheimer's disease. Is that right? So, do you think you have any problem to remember things, or what do you think is the problem why you cannot recall the numbers from the way you were asked to say it?
Yeah, at times I just get stuck. It's like my brain just gets blocked at times.
Oh, sorry about that. But I would like to let you know that you don't have to feel bad about it. It happens to it happens at some stage in life. Oh, but it can be managed. You can still live a good life even despite that. Do you know that, James?
Yeah, thank you, nurse.
Oh, wonderful. So we just refer you to the dementia nurse and also to your community GP as regards the urine pain with urination, and the score you have a score of 10 over 28, which is suggestive of some level of significant level of dementia, but nothing to worry about. Like I told you, the dementia nurse and the community GP will follow up on that. But meanwhile, I would just advise you do some active exercise, your eat good food, balanced diet, no social connections. I know, though, even though you live in the community, but you can still connect with friends, no, get involved in some social activities even in the community, in the nursing home. That will go a long way to keep you active. Is that okay?
Yes, ma'am.
And that's all I have for you, James. Do you have any concern for me? Any question?
No, thank you for your time.
Oh, wonderful. Thank you for your time, James. Nice meeting you. And I'll be back to see you again in the next 2 weeks.
Yeah.
So I remove my gloves. It goes on the clinical waste. My apron, my gloves and apron goes on the clinical waste. I do my hand hygiene. So if after I've gone, if you need any help, do you have your GP's number with you?
Yes, nurse.
Okay, wonderful. And in case of any emergency, you can always call 999. For non-emergency, you can call 111. And you have my number as well. You can call me if you need any help, or you just reach out to the community team. We'll be right there to help you. Is that okay?
Yes, thank you.
Okay, wonderful. Bye for now. See you.
Bye.
Yeah, thank you for watching. Wishing you all the best. And for the 6CIT, it's just a form, a cognitive tool used to assess people with any form of cognitive um, memory loss, dementia. So it has 6 components, and it will be pre-filled already, just like your PHQ-9 and your MOS charts. So you just talk about the areas filled. It's called the total score is over 28. So whatever the score, 0 to 7, it's normal. It doesn't call for concern. And 8 to 9, it's a mild form of dementia. It's suggestive of a mild form of dementia. And 10 and above calls for a serious investigation. It's significant form of dementia. And of course, they can be referred to the dementia nurse, community GP for further plan of care and needed investigations. Hope this helps with your Alzheimer's scenario and the 6 cognitive impairment test too. All the best. Thank you.